I was hoping you would talk about value-based care because we talked about that in our first call. And, I wouldn't mind if you would link that to what Newtopia is doing a little bit differently out there right now.
Yeah, sure, and I think it's an important component. So if we go back to the structural challenge and the incentives, right now, for the most part, sick care is based on a fee for service model, which means individuals will go in when they're not feeling well, go and see a provider, doctor, or specialist of some sort, and for the time spent, there will be a transaction. Most of us don't see it; it happens behind the scenes, which is also a little bit of a challenge because it's completely we're blind to it. But it's tied to throughput, not an outcome, and that means that the incentive to drive an outcome isn't there because the economics aren't tied to it. So value-based care or fee for value twists that around and says the economics are going to be on the outcome, not necessarily on the event itself. And so we started our economic orientation as a value-based group, which means that we only get paid if we drive an outcome proven to reduce risk. And the risks we're focused on are key metabolic risks, things like your waist circumference or blood pressure, your triglycerides, cholesterol, your A1C, etc. Only if we impact those do we get paid. But if we don't, even if we spend the time, we don't get paid. And so that value-based orientation has had a lot of talk track, and it is one of the key approaches that needs to take place for us to move toward a greater focus on prevention.